success, lots of love, joy, and happiness. To you and your family, Merry Christmas. From KNLY 91.1 FM, The Boss.
Are you great with people? You have professional experience? 91.1 The Boss wants to interview you as a sponsorship promoter. Contact us today at 713-370-5051.
We are broadcasting live from the Woodlands, Texas to the world. You're listening to the only multimedia FM station in Houston, Texas. Your Fusion Radio. Top 40s, dance, Latin, country, pop, rock and roll. All in one station. Mixing genres and generations. You're listening to KNLY New Waverly, Texas. 91.1 FM, The Boss.
The program presented or submitted by members of our community and are a proud sponsor of KNLY 91.1 FM. The views expressed do not necessarily reflect those of KNLY 91.1 FM and its affiliates.
Buzz Radio Show, DailyBuzzRadioShow.com, RadioBoss.com, 91.1 FM, TheBoss.com. I did not catch the pin.
I thought you weren't even going to try.
Tressa Ray!
It's Monday. You shouldn't even try to catch the pin.
It's automatic you're not going to catch it on a Monday.
Yeah.
Tressa Ray!
What's up?
Hey, how was your weekend? What did you do this weekend? Tell us what you did. Tell the world the weekend of Tressa Ray.
I had a pretty busy weekend.
Of course.
But the one of the highlights of the weekend, besides my daughter's dance recital, which she did amazing, of course, because she's my daughter and she does great at everything she does. However, besides that, I went to a toy drive yesterday at
HTX Tactical. Javier. But they had an interesting toy over there, didn't they?
They did. They about 30 minutes before the toy drive ended, they went and grabbed these huge machines, like this big, started filling it up with gas, and everybody's like, what are they doing? What are they doing? And then all of a sudden, he's like, you want to see some flame throwing? And in my mind, I'm thinking, there's a professional that's going to do this. Well, I guess Javier...
They're in a parking lot filled with cars.
Yes. I guess Javier is a professional because he got in that parking lot with his friend, and they just started...
I saw the video.
It was crazy.
I don't know what you do with a flamethrower in Houston, Texas, but in case there's a war and we need a flamethrower, we know someone has one.
It was really, really cool. They had a bunch of people out there. They had a barbecue out there.
Really?
They had music.
They had actual toys there, too. I saw that.
Yes, so they had one of the trucks, and it was like a huge lifted truck.
I saw that,
And they had, when I got there, the toys were already touching, like, the tailgate
of
the truck. And then by the time I was leaving, I mean, there was probably about like that much room.
How come our toy drives don't do that? What's up with that?
It was pretty amazing. It was. I mean, I guess we got to get Javier and his flame throwing out here for our next toy drive because that really brought out the people. Yeah, that was so cool.
You got some other things going on this week. What you got? Tressa, she's very social. She got all these different events, stalkers, you name it. Tressa, what you got going on this week?
At the Houston Karting Complex that we went to, the Fast
I won't go back.
Karting
That
place.
was fun.
Well, they're having law enforcement versus firefighter
Guns and
race-off.
hoses. That's what it's called. Guns and hoses.
Thursday, December 20th at 6:30 p.m.
Not the type of hoses you're thinking about. Guns and hoses.
If you want some more information on that, give 936-494-1827 a phone call to get more information if you want to be involved in the law enforcement versus firefighter race-off.
That was we went out there to this track. He put us out there, let us get a taste of it. It was like IndyCar racing, man. It was fun. They go up to like 50-something miles an hour. And then, of course, Miss Thing here had to spin out in front of me. I plowed right into her. It was fun.
He was trying to take me out. I knew there was something wrong whenever we got back to the office, and he was like, oh, I guess I need to take that ad off of Indeed. And I was like, for what? He goes, a co-host. And I was like, that's why you ran into me.
You know, hey, you're going to go one way or another around here, girl. DailyBuzzRadioShow.com. Go to Facebook Live. Look us up. Make a comment. We will shout out to you. Any Facebookers out there, put your comments up. Tressa Ray's monitoring them, and I will pop them up. We will shout out to you. Now, let's talk about today. We're going to take a short commercial break, give you Facebookers time to do all your logging and whatever it is you do there to do that. And we come back, we got a very unique gentleman, Dr. Johnny Pete. He was actually featured on the Great Day Houston show last week, and we got him in studio. We had to fight off all the fans out there, and people wanted to get his autograph. We finally locked him in here, and we're going to talk to him about all types of different stuff. So we'll be right back. Do not
go away.
We'll be right back. Bye-bye.
Hey, don't change that dial. We will be right back with the Daily Buzz Radio Show.
Follow us at KNLY 91.1 FM.
Do you want to make your college experience different? Become an intern with 91.1 The Boss. We are interviewing interns today. Contact us at 713-370-5051.
Follow us at KNLY 91.1 FM. Mixing genres and generations, all in one station. 91.1 FM, The Boss.
Could your business use more customers? Could your business use more online traffic? Sponsor with 91.1 The Boss radio station and let our multimedia radio station promote your business. Contact us today at 713-370-5051. Are you great with people? You have professional experience? 91.1 The Boss wants to interview you as a sponsorship promoter. Contact us today at 713-370-5051.
This is E.L. Crane of Real Estate U here each and every Saturday, 11 a.m. to 1 p.m. on 91.1 FM The Boss. Remember, that's Real Estate U. Insightful, informative, and a little humor tossed in. Real Estate U, listening live, 11 a.m. to 1 p.m. each and every Saturday at 91.1 The Boss.
Woohoo! We're back with the Daily Buzz Radio Show.
Welcome back to DailyBuzzRadioShow.com.
Why do you have to do that to me?
That was Tressa Ray with her. Woohoo! DailyBuzzRadioShow.com. We'll also go to Facebook Live. Make your comments. We have a lot of very interesting stuff we're going to talk today. We have, besides the woohoo, we have Dr. Johnny Pete in studio. He's at Woodlands Gynecological and Aesthetics Center.
There you go.
Oh my God,
Words are
Dr.
hard
Pete.
sometimes. It's okay. It's Monday. We're still getting it together. We
Cocoa
just had
Light,
we just
Light.
had our first cup of coffee, so give us a break.
Close to it.
We'll get it.
Dr.
we'll get
Pete,
it.
now but you have two medical practices right next to each other over there, don't you?
Yes, we sure do. Thanks so much for letting me visit
Yeah.
with you guys today. It seems like it's going to be a pretty exciting time for the next half hour.
Yes.
So yes, I have a gynecology office
Uh-huh.
here in the Woodlands since 2000.
wow,
We're over
okay.
near the St. Luke's campus since 2004. Our gynecology practice, it's full service. And then next door, we have Woodlands Medical Aesthetics Institute. So you can find us at woodlandsmedicalaesthetics.com. That is an aesthetics practice that really is on the cutting edge of everything in aesthetic medicine. We treat men and women and just a whole lot of services. Please visit the website.
Now, we'll get into the women's side here in a minute. I'm going to play a little prejudice here. What are some of the... why are you looking at me like, you old man? What are some of the issues men come to you about?
Well, we are a cutting-edge hormone clinic. We treat hormones in men and women, premenopausal and postmenopausal women, and then men really of all ages. So we do a lot of testosterone, bioidentical testosterone optimization in men. And
Dr. Pete, I'm sorry. Would you repeat that again, sir?
we optimize testosterone in men with bioidentical hormones.
Bioidentical hormones. What are bioidentical hormones?
That's actually a really good question. What makes them different from hormones you'd get at a pharmacy? The hormones that we use at BioT, the company that supplies my hormones, are derived from wild yams, and they're extracted. The estradiol and the testosterone are extracted from wild yams, and those hormones are the exact chemical formula or representation of what the receptors in your body are looking for. They're
Really?
an exact match for the estradiol and the testosterone that your body is making, just maybe not making as much as it used to. So when you receive these hormones, your body can immediately take these hormones in. It recognizes them as its own. It doesn't have to alter the chemical formula in any way, because when you alter the compounds, that's where you get into side effects and problems. So the bioidentical hormones work very well, both for men and women. But for men, in our Aesthetics Institute, we treat all the things that men care about the most, right? And we talk about this a lot. Men are simple, right?
And we sure are.
Yeah. So
Remote control, football,
Wait,
something.
that's a real statement?
So, let me
real statement right
rephrase
there.
that.
Men
What
are
I meant
simple.
was simple-minded. Is that better?
Okay, maybe.
I'll take that.
Men are
That's a
simple-minded.
compliment. Thank you.
So for most men, if you optimize their testosterone levels
Yeah.
and give them a cold beer, they're fine.
Yeah.
There's nothing else they need. So we
Bingo.
take care of both those things there in the office. But for men, we also deal with hair loss for men. We have everything that can be
My
done.
mother's favorite son has that issue. Over
Everything that can be done for hair loss for men, we do short of hair transplantation. So
Now, is hair loss the same as hair rejuvenation, where it comes back?
the way we regenerate hair is with platelet-rich plasma, with hormones, with topical treatments, with prescription medications, and we use lasers on the scalp to help replenish hair loss in men.
Wow.
The other thing that we do for men is we treat erectile dysfunction across the entire spectrum with medications, shockwave therapy, platelet-rich plasma injections, testosterone therapy. So really a full-service place for men. Because
Which is, most men say, oh, it's some older guy that, has issues, but it affects all ages, doesn't it?
Absolutely. And when we optimize hormones in men and women, we're also paying close attention to vitamins, nutrients, diet, exercise, other hormones such as thyroid. So we don't just focus just on the testosterone. So the men that come to our office not only look better and feel better, but they're more healthy as well.
That's it. And from the outside looking, it sounds like no two treatments are ever going to be the same.
Correct.
Somebody comes in, you got to almost look at their life, everything, and then calculate how much of this, and this you have to do to basically have them walking out a new man. But how many treatments does it take?
Well, you're exactly right on having it be custom. We have a BioT, the company that supplies the hormones. We have a software program that calculates your hormone dose based on your kidney function, your age, your weight, and your starting hormone levels, both for men and women. So you're getting a dose specifically for you and how you function. And most people feel better within a few weeks of the first treatment and then moving forward from that point on.
And Dr. Peep, you say feel better, you mean what, more energy? What is the first symptom?
Well, and it depends on what the deficiencies are. So let's say testosterone. Testosterone deficiency in men and women is very similar. Men begin to lose 3 to 5% of their testosterone beginning in the late 20s. So by the time most guys are in their 40s, the testosterone levels are down to 300 to 400 range, whereas they used to be in the 800 to 1,000 range.
Oh, wow.
And there's a big difference between 400 and 900 as far as how you feel and how you function. And for men and women, the symptoms of low androgens or low testosterone are really the same. That's fatigue, poor concentration or focus or clarity of thought, joint pain, poor sleep, anxiety, decreased libido, decreased sexual performance. All those things are things that the hormone therapy will fix.
Well, you just described me. Mine's a few towards the end there, by the way. Give my disclaimer.
Oh my God. Oh my God.
Anyway,
La 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 la.
the child did not need to hear that.
I didn't like that one.
That's incredible. Now, let me ask you, is there a free evaluation, or how do your patients, as far as determine if this is something for them?
Well, typically what we do, if patients have medical insurance, we will see them in the gynecology office and just use an insurance office visit for the office, and they can pay their copay. The laboratory evaluation that we do is covered by insurance if people have it. If people do not have insurance, our initial evaluation is only $100. And,
Really?
The full panel of blood work is about $150, and that's about 20 different lab tests, including blood count, blood sugar, liver, kidney tests, electrolytes, vitamin D, vitamin B12, testosterone, estradiol, and 4 thyroid tests.
That's extremely reasonably priced. Wow.
It really is. Yeah.
Well, let's flip the coin now and go over to the difficult side. Tressa Ray,
Listen.
go ahead. You have female questions. Go ahead.
I have female questions.
I didn't say issues. I said questions.
Kind of odd to say. But I do. We got a chance to look at your website, so we do know like some of the other things that you offer, which a lot of it is for women. So, do you want to tell us about like?
Let's
what you
just jump
offer
straight
for
into
women?
this vaginal rejuvenation.
Well, that was one of them. But
Yes.
I mean, it's like
So-
8 things on the website. You picked that one.
What we typically do is, in anyone that we're evaluating, we really try to focus on their hormones first,
Yeah.
fix their hormones. So, in a premenopausal female patient who's still ovulating, releasing eggs, making estrogen, we usually don't have to supplement estrogen. It's usually just testosterone, because women will lose testosterone starting in their 20s, especially after having children, and they will see all of those symptoms that we talked about in their late 20s, early 30s, and beyond. Once the testosterone's gone, it really doesn't ever come back again
Really?
like it used to. And so we try to optimize that in women. Now, the same symptoms that we treat in men, we're treating in women. It's a loss of muscle tone and strength, mental focus, joint pains, sleep, anxiety, libido, all those things improve. Now, when women reach menopause, it becomes a whole other issue altogether, because at that point, they're going to lose their estrogen and their progesterone. So we have to add that into the mix. And so for women, we have to balance and optimize thyroid, estradiol, and testosterone. And then when they reach menopause, we're doing progesterone as well, all bioidentical.
So
it's-
they are more difficult to deal with, or treat.
I would say
I was going to say, wait.
we usually use the
Careful with our
word
words.
complex.
Complex, there you
Yes,
go.
something
We are
like
very
that.
complex.
I love
I
that.
agree with
A
that.
little more complex. So we always fix hormones first. Now, we have a lot of lasers in our office.
Yeah.
We do facial skin resurfacing, hair removal, lasers for photofacials, rosacea, removing pigment. And we do a lot of the standard things that are going to happen in an aesthetics office, Botox, fillers. We do body sculpting with the M-Sculpt electromagnetic stimulation, and also cool sculpting with freezing fat. So a lot of those services. The laser vaginal rejuvenation is one part or platform on our laser. And what that does is it treats the vaginal lining to help patients with a lot of symptoms that occur with aging, with hormone loss, with childbearing. All those things are pretty traumatic on the pelvic floor. So with the vaginal laser, we see improvements in urinary control, the ability to reach climax, lubrication, alleviation of pain, and also perhaps laxity. A lot of those things that typically are problematic as people age.
Wow. You know, I love this. Dr. Johnny Pete here in the Greater Woodlands area. When we come back, we're going to have a few more questions we have lined up for Dr. Pete. So we're going to take a break. Do not go away. We'll be right back.
Hey, don't change that dial. We will be right back with the Daily Buzz Radio Show.
Follow us at KNLY 91.1 FM.
Do you want to make your college experience different? Become an intern with 91.1 The Boss. We are interviewing interns today. Contact us at 713-370-5051.
Follow us at KNLY 91.1 FM. Mixing genres and generations, all in one station. 91.1 FM, The Boss. Follow us at KNLY 91.1 FM.
Could your business use more customers? Could your business use more online traffic? Sponsor with 91.1 The Boss radio station and let our multimedia radio station promote your business. Contact us today at 713-370-5051.
May this season bring you lots of success, lots of love, joy, and happiness. To you and your family, Merry Christmas. From KNLY 91.1 FM, The Boss.
Are you great with people? Do you have professional experience? 91.1 The Boss wants to interview you as a sponsorship promoter. Contact us today at 713-370-5051.
This is E.L. Crane of Real Estate U here each and every Saturday, 11 a.m. to 1 p.m. on 91.1 FM The Boss. Remember, that's Real Estate U. Insightful, informative, and a little humor tossed in. Real Estate U, listening live, 11 a.m. to 1 p.m. each and every Saturday at 91.1 The Boss.
Woohoo! We're back with the Daily Buzz Radio Show.
Welcome back, DailyBuzzRadioShow.com. We have Dr. Johnny Pete, gynecological aesthetics. And we have Tressa Ray, who wants to talk about her eggs. So, with that, we're going to let Tressa Ray talk.
My God.
Talk.
All right. Well, now that I'm fully embarrassed right now. So, I am 28 years old.
Young.
I
So
had
young.
a child.
28? My God, I got shoes
know.
older than that.
I had a child very young, but and I'm not married. I'm not in a relationship right now, so there's always that question in the back of my mind, like, okay, when I'm ready to have kids again, am I going to be able to? So, how you were talking about like testosterone levels dropping and you having to go through all of that stuff, do you, if I need help with fertility, would you be able to help me?
Sure. So we have a full-service gynecology office, which includes preconceptional counseling and helping people deal with fertility problems, both non-surgically and surgically as well. And testosterone doesn't usually play a role in fertility. So if you're having a cycle every month and ovulating every month, then you could become pregnant. And at 28, you're very young, so certainly nothing to worry about there. But we do a pretty extensive laboratory panel just to check vitamin levels and hormones to see where everything is. The testosterone is not so much involved with fertility as it is with more quality of life and aging. But certainly that's part of what we do every day in the office.
Hey, you know, young ladies Tressa's age, what's some of the common issues they deal with?
Well, we deal a lot with contraception. And cancer screening. So pap smears, STD screens, also just making sure we've got adequate birth control and you're up to date on all those services. You know, when you're in your 20s, there's not a lot of problems that crop up, but from time to time people have some issues and some problems with pain or other things that we need to help address. But then as patients get older, we focus a little bit more on cancer screenings and things of that nature.
You've been out here practicing. Actually, you told me you grew up in Conroe area, and you decided to put your practice out in the same area where you grew up here in this Greater Woodlands area. You've been practicing since 2000, which is 18, almost 19 years now. Yep. You must have I hate to use the word following, but you've got a base of patients who basically you've seen them throughout their different stages of life.
Absolutely, and you know, my father was a family doctor in Conroe for 42 years, so he had a pretty large group of patients before he retired, and I see a lot of those folks that have known me since I was born, essentially. But yes, that's one of the beauties of doing gynecology. It's like primary care. These patients I've been taking care of some of them since the year I got here, and you really get to know them over time and develop those long-term relationships.
And know their families.
They're excellent.
Well, you must get a ton of referrals too.
I'm starting to have some of these babies I delivered when I first got here now graduate high school.
Oh, wow.
Yeah, that'll make you feel old.
That happens, yeah.
So you do take insurance, right?
Yeah.
For both of your practices?
Just for the gynecology office. The aesthetics office at woodlandsmedicalaesthetics.com is strictly, there's no insurance contracts there. It's all just
Is that because a lot of insurance don't cover that, or what's the...
Yeah, the insurance doesn't cover any aesthetic services for the most part, so it's just
But your prices are so reasonable. I mean, that's...
Yeah,
most men and women out there would not realize. In our head, we think, "Oh, we can't afford that."
The reality of it is that insurance companies and pharmaceutical companies don't charge reasonable rates, and so it's actually easy to beat their prices. So when we do lab and we do office visits, and when I do hormone therapy, it's actually cheaper than if you're relying on your insurance to get it done.
And you walk out feeling like you're just rejuvenated in the world, huh? How many treatments before you feel that way?
You know, typically you're going to feel better 2 to 3 weeks after your first treatment, and you're going to continue to feel that way. So we use, for the estradiol and testosterone, we use subcutaneous pellets about the size of a grain of rice that we implant underneath the skin on your hip, just like you're getting a shot.
Really?
And they dissolve on their own. For men, they last about 5 months with one placement.
You're serious?
For women, about 3.5 months. So in our office, we've probably done over 8,000 placements. So we have a lot of patients on bioidentical subcutaneous
But let me ask you something,
pellets.
Dr. Pete. Somebody invests their funds, their money, their time for this treatment. They also have to change their lifestyle, don't they?
Well, sure. Most people are interested in sleeping better, losing weight, getting more energy. It's hard to do all of those things if you have a really bad diet and you don't exercise. So, you know, the hormones can get you to a certain point. But then at that point, I say, I've kind of done all I can do. If you're looking for more,
It's up to you.
Look in your refrigerator and,
Look in your refrigerator.
and clean it out and replace some of those items.
No, don't take my chocolate cake.
Oh no.
Well, you know, but that's what it comes down to. And when you get older, there someday, there,
I feel
Tressa,
like I'm there.
you're not there, young lady. You're extremely young
I
lady.
found a few more gray hairs since I started working
Oh
here.
my
so.
God! Do I get out a violin? Okay. You know, as you reach certain points in life, you've been through a lot, and you think the stress. You know, stress takes a lot of chemicals out of your body. I mean, it takes a lot of wear on your body, so to speak. And as you go through life, you naturally deal with stress. I've dealt with stress longer than you, just because I'm older than you. You dealt with less because of your age. But a lot of this helps you deal with stress, doesn't it?
Exactly right. I mean, that's what these hormones are for. A lot of people say they have struggling adrenal glands because they can't handle stress like they used to. The reality of it is the testosterone would take care of that for you if you had any, and your adrenals would get a break. So we see a lot of people who, when we fix their testosterone, their adrenal hormones increase because their adrenals aren't working so hard anymore, and their energy's better and focus, and they feel 10 foot tall and bulletproof. That's what I'm looking for.
I remember those days. And so, an example, I'll throw myself out there on the bus here. You said, no, it's going to be... oh no!
Keep it clean. Keep it clean.
You
Great.
said,
I can only
I tell you,
imagine where
I'm
this is going.
52, and you said my level should be about 1,000. They're probably, like you said, around 300 range right now. So over this period of years, from I guess 30 to 52, I've lost all this testosterone. Correct?
And it happens slowly. It's kind of an insidious process. So if you lose 3 to 5% a year, you keep adjusting and you keep finding a new norm, and you fight through it.
Tressa Ray, did you learn something from this?
I did learn a lot
This
today.
is, you know,
I feel
this is
like I
almost
need
like
to
an
come see
untold
you.
secret.
It is.
I hate to use the word spa because it really cheapens what you do, Dr. Pete, but this is like a medical spa that you can walk into and walk out with a solution to get you going if you're willing to change at a reasonable price and make you feel like $1 million again.
So what goes into that first? Can you recap on that very first visit that somebody would have with you that you said was for $100?
Well, they would come in and fill out all of our new paperwork, and we're going to do a medical history, and a brief physical. We certainly don't do the in-depth gynecological physical at that first visit. We just do a brief history and physical, and then give the patient information to read and go over all the hormones and those types of things, and then we draw their blood, and then we see them back at a later visit to go over all of that. And if the patient's certain that they want to have testosterone or estradiol placed at that visit, then we do it at that second visit. We will place the hormones, and a month later we draw blood levels, because we have goal blood levels we want you to be at, and if you're not there, I give you some free pellets to make sure we get you there. So we have goals for all these labs that are very important, and especially in women. Thyroid, we like for people to be in the upper quartile of the reference range, because where do you want your metabolism, at the 10th percentile or the 90th percentile?
Yeah.
Right?
Exactly.
So where do you want your energy and your metabolism and your weight control? So we focus on thyroid, which is not the pellet therapy, but it's just a small prescription bioidentical medication. So we kind of go through a process with folks. It's very simple, quite
I love
easy,
this.
not terribly expensive at all, and not everyone does pellet therapy, not everyone does testosterone, but there's a lot of other things that we're doing with thyroid and with vitamins and with helping you with diet and exercise. And if there's other things that are concerning you that we can take care of from an aesthetic standpoint, then we have a big
so
staff
cool.
to do it.
Dr. Johnny Pete here in the Woodlands, Texas. Dr. Pete, how do they find you? Your office?
The gynecology office phone number is 936-273-1600, and the aesthetics office is 936-273-9053. WoodlandsMedicalAesthetics.com.
WoodlandsMedicalAesthetics.com. Incredible information. Now I understand why you're on Great Day Houston.
Yeah.
You know, and this is incredible. We look forward to having you back in here. This is really something that we need to have you back on a regular basis to talk about, because this is incredible. We're going to take a short break. When we come back, we're going to talk about what's coming up next week. Dr. Pete here in the Woodlands. We'll be right back.
Hey, don't change that dial. We will be right back with the Daily Buzz Radio Show.
Watch us live in our social media, Facebook Live, YouTube, Twitch, Periscope, at KNLY 91.1 FM.
Do you want to make your college experience different? Become an intern with 91.1 The Boss. We are interviewing interns today. Contact us at 713-370-5051.
Follow us at KNLY 91.1 FM. Mixing genres and generations, all in one station. 91.1 FM, The Boss. Follow us at KNLY 91.1 FM.
Woohoo! We're back with the Daily Buzz Radio Show.
Hey, DailyBuzzRadioShow.com. Tressa Ray, tell us what we have coming up.
All right, so tomorrow would like to invite you guys to Pacific Yard House from 5 to 7. The mayor and the governor's office will be there. They're going to have a live band and everything tomorrow.
That's in Conroe,
from
right?
5 to 7 at Pacific Yard House in Conroe, Texas.
Hey, thank you so much for listening to DailyBuzzRadioShow.com, RadioBoss.com. We'll be back tomorrow with who?
We are going to be with Martin and Ozzy tomorrow.
Martin and Ozzy. See you tomorrow, 12 noon. Woo!
Watch us live in our social media, Facebook Live, YouTube, Twitch, Periscope, at KNLY.